race to find a COVID-19 vaccine is on, but so is the rivalry among countries around the world about who will have access to it. Middle-income countries, including South Africa, will have to compete for access to COVID-19 vaccines with much wealthier countries that can not only pay much more for such goods, but that have already clinched deals with drug companies to get those vaccines first. South Africa has applied to be part of the COVAX agreement. Let's talk to the Bekisisa Center for Health Journalism's Safura Abdul Karim, who is a senior researcher and public health lawyer at the SAMRC Center for Health Economics and Decision Sciences. All right, let me get straight into the interview there. Good evening and thank you so much for your time. Firstly, why is it that South Africa has decided to join the COVAX agreement?
Good evening and thank you for having me. I think one thing has become apparent in the last few months, and that is that this pandemic is not going to go away without a vaccine. What has also become apparent is that there's now a race to get access to this vaccine, and at the moment it's going to the highest bidder. Joining the COVAX agreement gives South Africa, a small and relatively poor economy, an opportunity to bid and compete against countries like the US and like the UK to get access to a COVID vaccine and make sure that that price that we get is affordable to us.
The impression that one gets is that for smaller countries, the best way to navigate this terrain is to rally together and form almost conglomerates together or coalitions together. Is that what we're seeing South Africa do as part of this agreement?
So South Africa hasn't yet received the opportunity to be formally part of COVAX. We've applied along with 72 other countries. But yes, COVAX is precisely that. It is a mechanism by which smaller, poorer economies are coming together and pooling their bargaining power to get access to a COVID vaccine. It is a very powerful mechanism for solidarity in accessing a COVID-19 vaccine. And of all the countries that are part of it, a majority are going to be low and low middle income countries, really small economies that would not be able to afford the vaccine at all. And they're joining together with countries like South Africa that will be able to pay for the vaccine but may not be able to compete in terms of bidding against the US or the UK.
Are there disadvantages for being part of this agreement?
So I think the biggest disadvantage is we don't know whether or not we're going to be a part of it. And that decision is not up to, some global body. It's actually up to the board of an organization called Gavi, which is a Gates-funded public-private partnership. And they have only say on who's getting to join this agreement and how much we're going to pay to be a part of it. And I think that is the thing that is making the COVAX situation a little bit complicated. We don't know if we're going to be part of the countries that are allowed to be part of COVAX, and so we don't know if we're going to get access to this amazing cheap vaccine.